When it comes to ovulation and fertility, there's no shortage of myths and misconceptions. Have you ever wondered what's true and what's not? Glowing star, understanding the science of ovulation and how it impacts fertility is crucial, especially if you're trying to conceive. In this video, we'll dive deep into the facts, uncover common myths, and explore the fascinating biological process behind ovulation. Let's separate the truth from fiction and empower you with the knowledge to take charge of your reproductive health. DNA sparkles. When it comes to ovulation and fertility, there are plenty of myths and misconceptions that can lead to confusion, frustration, or even unnecessary stress for individuals trying to conceive. This guide aims to uncover the truth about ovulation, its role in fertility, and the importance of understanding the menstrual cycle to help maximize your chances of conception. Understanding the science of ovulation. Ovulation is a critical part of the menstrual cycle. It refers to the process where a mature egg is released from the ovary, ready to be fertilized by sperm. Let's break it down step by step. The menstrual cycle phases. The menstrual cycle is typically divided into 4 phases. 1. Menstrual phase. The cycle begins with menstruation, the shedding of the uterine lining. 2. Follicular phase. Hormones stimulate the growth of follicles in the ovaries, with one becoming dominant and preparing for ovulation. 3. Ovulation phase. Triggered by a surge of luteinizing hormone, LH, the dominant follicle releases an egg. 3. This typically occurs around day 14 in a 28-day cycle but can vary. 4. Luteal phase. The body prepares for a possible pregnancy. 4. If the egg isn't fertilized, hormone levels drop, and the cycle restarts. Hormonal changes during ovulation. Hormones play a vital role in regulating ovulation. 1. Estrogen rises in the follicular phase, signaling the body to prepare for ovulation. 2. Luteinizing hormone, LH, spikes just before ovulation, triggering the release of the egg. 3. Progesterone increases after ovulation, helping to maintain the uterine lining for potential implantation. Common fertility myths and the truth myth. Ovulation happens on day 14 of every cycle. Fact. While ovulation often occurs around the midpoint of a 28-day cycle, every person's cycle is different. Ovulation can happen earlier or later depending on the individual and external factors like stress, illness, or lifestyle. Myth. You can only get pregnant on the day of ovulation. Fact. While the egg is only viable for about 12 to 24 hours after ovulation, sperm can survive in the female reproductive system for up to 5 days. This means the fertile window spans several days leading up to and including ovulation. Myth. You can feel when you're ovulating. Fact. Some people experience ovulation symptoms like mild pelvic pain, increased cervical mucus, or heightened libido, but many do not notice any symptoms. Ovulation predictor kits, OPKs, or basal body temperature tracking can provide more reliable insights. Myth. Irregular cycles mean you can't get pregnant. Fact. Irregular cycles can make predicting ovulation more challenging but don't necessarily mean infertility. Understanding your unique cycle through tracking methods can still help identify your fertile window. Myth. Stress has no effect on fertility. Fact. Stress can disrupt hormone production and, in turn, ovulation. Managing stress through mindfulness, exercise, or therapy can support a healthy reproductive system. Why understanding your menstrual cycle matters to optimize fertility. It's crucial to understand your cycle and recognize when ovulation occurs. Here's how. Tracking ovulation. 1. Use ovulation predictor kits, OPKs, to detect the LH surge. 2. Monitor basal body temperature, BBT, to identify a slight rise after ovulation. 3. Pay attention to cervical mucus changes. Fertile mucus is clear, stretchy, and resembles raw egg whites. Timing intercourse. Having intercourse during the fertile window, the 5 days before and the day of ovulation, increases the chances of conception. Nutrition and lifestyle. 1. A balanced diet, regular exercise, and avoiding smoking and excessive alcohol can improve fertility. 2. Maintaining a healthy weight is essential, as being underweight or overweight can disrupt hormonal balance. Medical insights. If you're struggling to conceive, consult a healthcare provider. They can conduct tests to confirm ovulation and assess overall reproductive health. The emotional side of fertility. Fertility struggles can be emotionally taxing. It's important to address myths that can lead to unnecessary guilt or pressure, such as believing infertility is always caused by the individual, with irregular cycles or age being the sole factor. Emotional support, either through counseling or community groups, can make the journey less isolating. Conclusion: understanding the science of ovulation and fertility is key to debunking myths and increasing your chances of conception. By tracking your cycle, identifying your fertile window, and maintaining a healthy lifestyle, you can take proactive steps toward your goals. Remember, every person's journey is unique, and seeking professional advice when needed is a vital part of the process. Knowledge is empowering, so let's separate fact from fiction and embrace the truths about fertility and ovulation. Now you have the facts about ovulation and fertility, no more myths, just science-backed truths. Glowing star, understanding your body and your cycle is a powerful step in your fertility journey. Whether you're planning to conceive or simply curious about how your body works, this knowledge empowers you to make informed decisions. If you found this information helpful, don't forget to like, share, and subscribe for more insights. And as always, take care of yourself and your health. See you in the next video. 2 hearts.